Welcome to this video about an introduction to autism, part 2 of 4, identifying signs. Who can diagnose autism? Diagnosis of autism spectrum disorder, ASD, follows a range of assessments by medical practitioners, highly specialist psychologists, and highly specialist speech and language therapists. A formal diagnosis of autism spectrum disorder is usually provided by a consultant-level medical practitioner, typically a psychiatrist or pediatrician. The involvement of other professionals, such as occupational therapists and educational psychologists, may also be beneficial. Within the DSM-5, it is possible to be diagnosed with social communication disorder, but it is rarely used in this country. Important initial considerations. Social communication difficulties and differences are quite common. This is not itself a distinct category or type of SEN, nor do they always indicate that a person might be autistic. This can be influenced by various factors, including speech and language needs, an undetected sensory impairment, processing difficulties, anxiety, other neurodiversity conditions, for example dyspraxia, and SEMH needs. For example, a pupil who has experienced adverse childhood experiences, trauma, and/or attachment type difficulties may present with a range of traits that would be typically associated with autism. Autism affects pupils in different ways. There are many variables. Sometimes it can be difficult to identify any obvious signs of autism, especially if the pupil masks their differences. Identifying needs is a process, not an event. It is entwined with teaching, support, and intervention as part of the graduated approach. Different perspectives on autism assessments and diagnoses. We should always bear in mind that clinical assessments and potential diagnoses are not wanted by all children and young people or their parents and carers. In schools, we can find a diagnostic label useful so that staff have an idea of what the pupil's likely difficulties may be. The important thing is that we all recognise and support needs effectively. A parent and carer can request that their child's diagnosis is not shared with certain people or another school, for example. What might parents and early years professionals notice? At the typically expected age, a young child might not answer to their name, respond to smiles or other facial expressions and tones of voice. Use gesture, share experiences with familiar adults, for example, pointing, taking adults to a toy or place of interest, etc. Begin to speak in a typical way. Their speech may be delayed, sudden, or may regress. Develop reciprocal play skills. They may engage in repetitive play sequences, or react to stimulation in the expected way. They may have unexpected reactions to situations which seem innocuous to others. Adults might notice that the child tends to follow their own agenda regardless of what others are doing, struggling to shift their focus from what they're interested in. They might be struggling significantly with socializing with other children. They might appear to be overwhelmed, and this could be demonstrated by meltdowns and/or shutdowns. What might teachers notice? Difficulties with group work and peer relationships. Strong preferences or dislikes for features of the room, people, tasks, etc. Difficulty giving quick responses or in getting started with tasks. Unusual or unexpected social behavior. Strong reactions if something changes unexpectedly. A literal understanding, may misunderstand. Perfectionist, doesn't want to get things wrong. Difficulty following instructions and directions. A misunderstanding with multi-step questions. Difficulty concentrating and easily distracted. Difficulties with self-organization and attention. And a difficulty with certain teachers but not others. They may behave differently in different contexts. Social communication indicators initial checklist. A good starting point is an initial traits of autism checklist, which helps to establish what differences are being noticed. The checklist should include a basic and concise list of traits that may be picked up by people working with the pupil. Information within the school that is routinely available from teachers. Teachers and teaching assistants can spot pupils who are presenting with social communication differences and difficulties in their lessons. Additional sources of teacher-held and class-based evidence includes attainment and progress data for subjects studied, baseline testing data, behaviour and engagement data and information, pupil work samples, and views provided by the pupil and or their parents and carers during meetings. In lessons. Following, preceding, or alongside the activities involved in gathering information, it is essential to also examine the pupil's experiences in lessons. This can be undertaken via lesson observations. For example, are some of the reported difficulties, which may be variable across subjects, linked with any issues that you can identify relating to the teacher's knowledge awareness of the pupil's abilities? Expectations of what the pupil can achieve, subject knowledge and specific pedagogies, use of assessment information and data, use of adaptive strategies as part of high-quality teaching for all, the deployment of teaching assistants, their general teaching skills, and their general behaviour management skills. If the answer is yes or maybe, it's important then to consider any professional support, guidance, and appropriate challenge that the teacher may need to remove or reduce the pupil's barriers to learning in these lessons. Additional observations and collating staff views. Additional observations that are very focused on the individual pupil help us to understand more about how the pupil acts and learns in different environments. Ideally, this should include observations in at least 3 different settings. For example, the playground, during a structured classroom activity, which might include both independent working and collaborative work, and during a transition period of the day. These observations help us to understand the pupil's strengths, interests, ways of learning, and what is difficult for them. Alongside this, staff views about the pupil should be collated from everybody who knows them, then summarised. There may be emerging themes which then require further exploration. Working positively and effectively with parents and carers from the beginning. Once concerns have been raised, it's important to talk with the pupil's parents or carers openly and constructively from an early point. Having a potentially autistic child or young person can affect families in a number of ways, and it is important to be sensitive and understanding about the journey parents are on. It is also important to remember that parents often have to share a lot of information about their lives with others. For example, whether or not there is any family history of autism, and they can feel that they are under the microscope. Using the term social communication differences is more appropriate than using the term autism at the earlier stages. Sensory processing difficulties. Difficulties associated with sensory processing and integration differences and preferences are a core feature in autism. We will now explore this in a little more detail. Sensory processing difficulties. These are our senses. Sensory processing difficulties. Sound. Some pupils find sounds painful, can have difficulty with 2 or more people talking at once. This can make it difficult to screen out background noise. Other pupils may be undersensitive to noise and find it difficult to process certain sounds or may seek out loud sounds. Sight. Some pupils may be oversensitive to some colours, patterns or light. Others may be undersensitive and therefore fail to see certain colours or transparent objects. Certain features, for example colours, may not be of interest to the pupil who therefore may not process this information, and some pupils may require visually defined spaces. Sensory processing difficulties. Taste. Oversensitive to the taste of certain foods and finds some taste very unpleasant, or undersensitive to taste and therefore enjoys eating highly flavoured food. Pupils may also experience difficulties with certain textures of food and changes to familiar foods. Smell. Some pupils may be oversensitive to certain smell. Others are undersensitive and might lick objects or smear substances so that they can smell things better or to block out other sensations. Sensory processing difficulties, balance. Some pupils might not keep balance easily and can have difficulties in certain environments, such as uneven or moving surfaces. Touch. Pupils who are oversensitive may dislike the touch of others or the feeling of clothing on their skin. Certain textures can cause distress. Other pupils might be undersensitive and as a result may have a dangerously high tolerance for pain or discomfort. Autistic people can be sensitive to light touch. For example, somebody brushing past them might not cause them pain. Sensory processing difficulties, interoception. This is the ability to detect and attend to internal bodily sensations. It helps the pupil understand what is going on inside of their body, like hunger, thirst, feeling hot or cold, fatigue, or a full bladder. Some autistic people do not feel these sensations until they're quite severe or not at all. Proprioception. Many pupils have difficulty sensing where the body is in space and having a sense of where it starts and ends. This clearly presents problems when moving around and in doing activities which involve movement. Sensory processing difficulties. A child avoiding eye contact is often their way to reduce the sensory input. Faces can be overwhelming and confusing. Adults often say, "Look at me when I'm speaking to you," but actually the child may already be overwhelmed by a situation and will feel unable to look at them. Sensory processing difficulties. If you can't work out what the problem is, it's often sensory. Sensitivity can change depending on the situation or the person's stress levels. Food, textures, colours and smells can also create anxiety. The autistic individual might find it hard to get ready or to get dressed. They may demonstrate sensory seeking and self-regulation behaviours, for example, stimming, marked by behaviours such as flapping of hands or spinning. They may demonstrate behaviours such as biting, pushing, humming, etc. But these are often sensory seeking input. For example, biting equals pressure on the teeth. Autistic people don't necessarily know that everybody doesn't experience senses in the way that they do, and vice versa. So they're likely to say, "It's very loud in here," as it is how they experience their environment. Demand avoidance. When communicating with a pupil, we should pay careful attention to how the pupil responds to the way they communicate and interact. Demand avoidance is a way that an autistic person can present. There is increasing literature on this, with research finding that pathological demand avoidance, PDA, is often driven by anxiety and the need to be in control. This can lead to emotionally based school avoidance, EBSA, in some cases. Masking or camouflaging. Masking is very effective copying of neurotypical behaviours, so the autistic self is hidden. Masking stems from negative reactions to the person being their authentic autistic self and getting a negative reaction, so they modify their behaviour to get positive reactions from others. Sometimes it's deliberate. Sometimes people don't realise they are doing it. It is very stressful and exhausting, but on the outside can look like coping. It is common in both boys and girls, although girls might be able to copy appropriate social behaviour more effectively. We will consider this now briefly. What happens when autistic people mask? Masking involves mimicking socially acceptable behaviour, such as making eye contact in conversation, using pre-prepared phrases or jokes in a conversation, copying others' social behaviour, and imitating facial expressions or gestures. Masking also refers to the ability to hide or hold anxiety in, to appear calm. This can result in meltdowns at home. Masking can also mean that some pupils might behave in a provocative or risky way without understanding the consequences of their behaviour. They can find themselves in risky situations repeatedly without being able to learn how to avoid danger or risk. Girls. Girls are often missed as they appear to be conforming. Note, gender questioning is more common in autistic individuals. Although we're talking here about girls, it can include non-binary and transgender individuals. Dr. Camilla Pang says, I feel autistic women are more likely to be described as anxious and an autism diagnosis overlooked, since it can challenge gender stereotypes. Teachers and professionals often do not see the issues that are going on at home, for example, outbursts and lack of sleep. From the voice of an adult autistic woman, if I pretended to like everything they liked and to go along with everything, then maybe they would accept me. How autistic girls can present. Girls tend to mask from a young age, from reception age in some cases, and copy social behaviours. They can be very aware of the need to pretend to be like their peers. This is exhausting. Their special interests are often less obvious, but do exist. For example, horses, crafts, boy bands, etc. They often seem to be model students, too perfect. Girls may have less obvious expressions of rigid and repetitive behaviour. They may seem to have good pretend play skills, but may struggle to distinguish between real and fantasy worlds. And their play may be based on mimicry or scripts from films, television, social media, and books. Their language may seem advanced, but girls may not ask questions or ask for help or clarification as they fear getting it wrong. Their way of speaking may sometimes seem slightly stilted. They may be slow to respond if spoken directly to, as time to process language and think of the right reply is needed. Girls may find it very difficult to make and maintain friendships, especially as teenagers. They may be on the edge of friendship groups or have one very close friend who they are unwilling to share with others. They can present with mental health issues linked with feelings of being a social misfit, anxiety, self-harm, eating disorders, depression, etc. This may be the first thing you know about. Transition from primary school to secondary school. Sometimes, leading up to the transition from primary school to secondary school, information may be shared that indicates a profile of possible autism-type difficulties that have not yet been explored further, possibly linked with masking. It can be helpful to rapidly gather the types of routine-based school evidence we've been outlining so far in this video, wherever possible, and to meet with the pupil, their parents or carers, and make use of a simple checklist, if appropriate. This is the end of this video. Parts 3 and 4 on this topic are now available to watch. You can view more videos on this channel in the About series.